Hey, what's up guys? This is your pharmacist Sidra and welcome to Pharmacy Tech Study Guide. In today's video, we're going to talk about the key differences between hospital pharmacy technicians and retail pharmacy technicians. The main role of pharmacy technicians in both settings is to prepare prescriptions under the supervision of a pharmacist. However, there are some differences that we're going to talk about in this video, and these differences kind of help carry out the role of both retail and hospital pharmacy technician in both the settings. Both roles are vital in healthcare industry. They operate in distinct environments and face unique challenges. First of all, let's talk about hospital pharmacy technicians. In a hospital setting, these techs collaborate closely with healthcare professionals. They assist in preparing and dispensing medications for inpatient and outpatient care. In contrast, in retail pharmacy, the technicians primarily serve customers at community pharmacies or drug stores like your CVS, Walgreens, or any other independent pharmacy. In retail pharmacy, you basically cater to individuals seeking prescription medication. So you're going to provide care to the outpatient customers who are going to bring in the prescriptions from either ER, or doctors are simply going to send their prescriptions. These are going to be your acute care or chronic care. So one of the significant distinctions between their roles lies in their scope of practice. Hospital pharmacy technicians often handle and compound complex and specialized medications such as your intravenous solutions, sterile compounding, nutritional mixtures, and chemotherapy drugs, which are very sometimes complicated, and there is even a minor risk of error could be critical or sometimes even life-threatening for customers or patients, which is one of the big liability and stress factor in the hospital pharmacy. You're also expected to have greater knowledge of medical terminologies because, like I said, you are required to deal with the inpatients, and in that setting, you're gonna read and update patient charts. In general, you're going to work closely with the pharmacist and other healthcare providers like doctors and nurses to ensure accurate medication preparation and distribution to patients within the hospital. On the other hand, as a retail pharmacy technician, of course, you are going to fill prescriptions and compound medications, but most of these meds that you're going to work with will be in the form of pills, tablets, oral liquid medications, and these medications aren't very life-threatening. Like the most error that you may make as a pharmacy technician would be maybe miscounting, wrong compounding, which, don't get me wrong, you cannot overlook that, but it's still not going to be life-threatening. And also, all the work that you're going to do would be supervised by the pharmacist, so less kind of workload lies on you and more pressure on the pharmacist. In hospital pharmacy, often the pharmacist is going to check the work order, and then you're going to compound the medication. The pharmacist looks at it again, and then it goes to the patient. But you're going to need to do all those calculations and chemotherapy preparations, which could be a little tricky. Now, the compounding that is done in the retail setting is also non-sterile, while in the hospital setting, that's done in sterile conditions, which is very, very tricky and requires a lot of caring, a lot of management in making sure that the environment you're working in is sterile. Like, you have to make sure your laminar hood is clear, your compounding area is all clean and sterile, and but in retail setting, that's not a big thing to worry about. So in general, I would say primarily your focus in retail setting is customer service and medication dispensing. Your primary duty would be processing prescriptions and performing administrative tasks such as data entry, insurance billing, counting medications, also managing patient profiles and inventory. You have basically a one-on-one interaction with patients. You answer their questions about not just the prescriptions, but also their insurance and medication pricing. So in addition to health and prescription related tasks, you are also going to handle the administrative tasks in retail setting. Another noteworthy difference in hospital pharmacy technician and retail pharmacy technician is the work schedule. Now, hospital pharmacy technicians typically work in shifts that cover 24/7 operations, including evenings, weekends, and holidays, as hospitals are going to provide round-the-clock 24/7 service. While in retail pharmacy, often most of these pharmacies follow regular business schedules, like they open from maybe 8 or 9 o'clock in the morning and operate until 6 or 7 in the evening, unless you're working in a 24-hour business setting where you may have to work a graveyard shift. So also some pharmacies may have extended hours and you may have to work weekend shifts or holiday shifts, but it's not still as bad as the hospital pharmacy. Another thing that sets both of these roles apart is the work environment. Hospital pharmacy technicians operate within a bustling healthcare facility where they collaborate with various healthcare professionals, including your doctors and nurses. Their tasks basically involve fast-paced, high-pressure situations. In retail pharmacy, the work environment is a little bit relaxed, which I'm sure a lot of people will debate about, but it's more customer-focused environment in addressing the needs of the patients who visit the pharmacy, and you're going to have a direct interaction with the customers. I would say that the retail operations are also fast-paced these days. Technicians are mostly complaining about being overworked and underpaid, and they're always mostly short-staffed. But you basically, if you're good at customer service, then your day would go by pretty well, and you have to be able to good at multitasking and customer service, because that would be one of your main tasks as a retail pharmacy technician. In terms of career advancement, both roles offer opportunities for growth. Hospital pharmacy technicians may specialize in areas like oncology, critical care, or infectious diseases, while retail pharmacy technicians can advance to positions such as pharmacy operations managers, and then from that role they can move further into management roles or pursue additional certifications. Like you can become a PTCB certified pharmacy technicians. Of course, that's going to give you a little bit of more benefit in terms of your wages and in terms of growth. In terms of salary difference, hospital pharmacy technicians make a little bit more than the retail pharmacy technicians, but then as a hospital pharmacy tech, there is a little bit more liability risk compared to retail environment. In retail pharmacy, you may start with a low wage, which could range from $16 per hour to up to $21 per hour, while the hospital pharmacy wage between somewhere between $21 to $23 per hour. And again, this is because the pharmacy techs working in retail pharmacy often report less stress, but again, this is debatable. Technicians in hospitals deal with more stress because they're dealing with a broader range of drugs, like your chemotherapy drugs, biological agents, parenteral drugs, which require utmost level of accuracy while preparing and delivering. And this is important because you have to make sure the right drug is delivered to the right patient each and every time. There is no math error, there's no drug delivery error, because that could be life-threatening to your patient. In conclusion, I would say both hospital pharmacy technicians and retail pharmacy technicians play vital role in healthcare system. Their responsibilities, work environments, and skill sets differ significantly, but understanding these distinctions is crucial for you if you are an aspiring pharmacy technician, so you can choose the path that aligns better with your interests and career goals. This wraps up today's video. I hope you found it helpful. If you have any questions, do leave it in comments, and I'll see you guys next time. Thank you.
Hey guys, if you found value in this video, give it a thumbs up, share it with your friends and family, and remember to subscribe to stay up to date on new weekly. Hey guys, if you found value in this video, give it a thumbs up, share it with your friends and family, and remember to subscribe to stay up to date on new weekly videos.